Welcome to the second YouTube training video on patient diaries. This video has been put together by the Critical Care Psychology team alongside the unit's patient diary champions, with thanks to Dr. Matthew Beardman for the use of his teaching materials. When should a diary be started? Diaries should be considered for all adult patients who have been admitted into critical care for 7 days or more, especially those patients who are mechanically ventilated. Patients who are under 18 years of age and those admitted following a deliberate suicide attempt should not have diaries routinely started for them. These inclusion and exclusion criteria should be considered as guidelines, and if you are not sure if a diary should be started, then you should contact one of the unit patient diary champions or the critical care psychology team. New diaries are accessible from the following locations: B3 Flow Room, A-Side Reception. If you have any problems locating a new diary, please let the critical care psychology team or unit patient diary champions know. Having identified a patient for a diary, the first step is to fill out a consultee information sheet, which is given to the patient's main carer to review. This explains about patient diaries and allows relatives the opportunity to ask any questions they may have before they consent to one being started. If they consent, then they will be asked to sign and date the attached declaration form. This declaration form is then added to the patient's medical notes. It's worth mentioning to the relative that the diary remains the property of the patient. It is not part of the medical notes and is written to help patients remember their stay. During times of restricted visiting, or if the patient does not have any visitors, the senior nurse or consultant may give their consent to start a patient diary. Diaries can be started for patients who cannot consent, since this is considered a best interest decision. Patient consent will be obtained by the diary team when the patient regains capacity. The next step, step 2, is to place the summary sticker into the patient's medical notes, then to place a patient addressograph into the patient diary folder, which is kept in the B3 Flow office. The patient's name and date of admission to critical care should be written at the top of the first page in the diary for identification purposes. The next step, step 3, the patient diaries will then be created jointly by staff and relatives on the patient's behalf and will belong to the patient. The first entry should include a brief description of the reasons for admission to critical care, including who looked after them, any procedures they have had done, or any equipment they were using. All entries into the diary should be made clearly in black ink and dated. Critical care staff should take the lead on completing the diary, as this process may initially be too overwhelming for the relative and because of restricted visiting on the unit. All members of staff are invited and are welcome to make entries. A diary with contributions from nurses, doctors, physiotherapists, speech and language therapists, dietitians, healthcare assistants, rehabilitation assistants, the chaplaincy, and the patient's relatives and friends is likely to hold more meaning than a diary filled in by one person alone. It's important to remember that the diary could be read by relatives or others without the patient's consent, so it is important not to include highly sensitive information. Over time, relatives should be encouraged to write in the diary on a regular basis and be offered greater involvement in the diary. Some relatives may prefer to keep their own diary. This is absolutely fine. The main thing is that we all work together to record useful information until the patient is well enough to do it for themselves, if they wish to. Relatives should be supported to contribute to the diary as soon as they feel able. It might be helpful to reassure families that there is very little that they can write that would make things worse for the patient. We encourage families to express themselves freely in the diary, since the patients usually prefer to know about things that have happened, even if they are upsetting to think about. Relatives or visitors might like to write about family events the patient's missed, birthdays that have happened, thoughts and feelings from family and friends, or messages from friends that haven't been able to visit in person. They might also want to include messages and drawings from children, or talk about news from the wider world that the patient would be interested in, for example, news or sports scores. Remind relatives that the diary must not be taken off the unit, but if they wish to write an entry at home, then they can do this on a blank piece of paper or continuation sheets, and these can be inserted into the diary at a later date. What to include in the diary? A key question to ask yourself when writing in the diary is, what will the patient want to know when they are trying to make sense of any disturbing memories that are continuing to trouble them following their critical care admission? You could write about their critical illness and its treatment, including what you did when you looked after them and any other significant events. Information about what is happening from the relative's perspective. Information about events from the outside world to help the patient reconnect with their life. So, for example, any sporting results, any significant news articles, or it can be useful to include how the patient condition has changed, if they've had any recent procedures and what that involved, if there were any worrying incidents. It can also be helpful to include details about the environment, such as any sounds they might be able to hear, like beeps from the machines on the ward, any smells or any changes in temperature that they might be experiencing. If anything is going on in the ward environment, for example, if the therapy dog had visited them. When you write your entry, it's important to include the date and time, as this can help the patients form a coherent timeline of their experience when they are reading it. When writing in the diary, a sensible approach is to write only what you would be comfortable to disclose verbally to a patient or their relative at the bedside. Try and relate what you write to how you would normally verbalize the information. Avoid using medical terminology or jargon and abbreviations, and to write in everyday layman's terms. Avoid any sensitive or personal information, including any detail of test results. It's not necessary to make an entry every shift. However, entry should be made when there is a significant event or milestone to write about. Examples include extubation, a tracheostomy procedure, or sitting on the edge of the bed for the first time. The writing style should always be professional and relevant, as much care and consideration should be taken with a diary entry as any other form of professional documentation. Use black pen and write clearly. On the left-hand side of this slide shows some examples of entries in a patient diary. The right-hand side shows examples to avoid. To summarise, the following principles should be held in mind when thinking about patient diaries. The diary is the property of the patient and is not part of the patient's medical record. We should assume that the diary will be read by relatives and others without the patient's consent. It must therefore not contain highly sensitive information. Our job is to facilitate the recording of information and safeguarding this information until the patient is well enough to make decisions about its future. Patient diary champions and critical care psychology will take overall responsibility for the diaries and will give advice, support, and when necessary will make decisions about what is in the patient's best interest. And lastly, the diary should be safely stored by the patient's bedside, ideally in the observation trolley when not in use.